I'm Alexandria Callahan. I'm the manager for our behavioral health department here in Chicago. I'm also a clinical sexologist. So I'm very excited to bring this topic of breaking the stigma, how to talk to your providers about sexual health concerns. Now, this is definitely a growing topic of interest for a lot of our patients, and we thought that it would be nice to give some more information to you so that you feel a little bit more empowered to speak with your providers as you're moving through your appointments. So first, we're going to start with looking at what sexual health is. So to gain a better understanding, it's definitely important to know like sexual health explores your overall sexual well-being and functioning, which can be impacted by illness, treatment, natural aging process, or other health concerns. Some of the sexual health related issues are infections such as HIV, STIs, sexually transmitted illnesses, RTIs, reproductive tract infections that have adverse outcomes such as cancer and even infertility. Sexual health also looks at fertility preservation, sexual dysfunction, diminished desire, and sexual violence. So there's a lot of things that are encompassed within sexual health. And a lot of times we get that misconstrued notion that it's just simply about the act of having sex. But certainly that we in this field know that there's just a small fraction that focuses on the sex piece. And it's really more about how your body is, how you're feeling within your own skin, what's happening, are things functioning properly. So the six principles of sexual health that Doug Braun Harvey is a psychotherapist and sexual health author and trainer, focuses on improving healthcare through the integration of sexual health. And he developed the six principles of sexual health. So consent, that is the main one. So that's definitely making sure in any relationship you have that consent. And it's not necessarily just your relationship with your partner, but it's also, with your doctors. You'll find a lot of times too for women. I know last time I went to the gynecologist, they said, is it okay if I touch you? This is what I'm going to do for your exam. Are you okay with that? So it's really nice that that's starting to become more of our culture too, to make sure that people are comfortable. We definitely never know what someone has gone through. They might have unfortunately experienced some sort of, sexual abuse or molestation where if someone touches you, that can be triggering. So having that consent piece allows you to have a little bit more control too and be in that driver's seat and say, you know what? No, I don't feel comfortable with this. Non-exploitation. So it's really making sure that you're not being exploited. You're private. You've signed whatever paperwork you need to for those consents. Everyone's on board. Honesty. So this goes both ways. We need the honesty within our medical field, but also from our patients too, and with your partners. So that really, it's all encompassing, saying if you're with your doctor, you're saying, okay, you know what, yes, I am having some issues. And it can be scary to bring that up. When we're talking about sexual health things, that there's an embarrassment too. It's I've had some patients say, well, my body's changing and I didn't really understand what was going through. I didn't know how to answer the question. So I just didn't say anything. And that can also lead to more serious things. That honesty piece too goes within our relationships. Certainly if you're meeting a new partner, we want to know that they're safe too. Yeah, that, if they had partners beforehand, they're not going to give you some sort of illness, especially if you're an oncology patient. Those immune systems are compromised. I actually had one patient who had a on and off again boyfriend, and it turns out that he got herpes and he didn't tell her, and they had sex, and she was just like, she found out after, and she's like, now I've been exposed to this and my immune system's already compromised. So those are the scary things too that we don't always think about. And certainly too, as a cancer patient, we have to be a little bit more hyper vigilant with that. Shared values. So this is really, around our relationships, making sure that your values around sex, sexuality, that all aligns. So, we live in a age right now too, where people are more explorative. You might hear the ideas of having open relationships or open marriages, or, there's swingers, there's different things. So it's really making sure that as you're navigating your relationships, that those align, you have those same values. If you want to be in a monogamous relationship where it's just you and your partner, well, making sure that your partner agrees with that piece and doesn't say, well, I want an open relationship, because you're going to have a lot of discrepancies then. The prevention from sexually transmitted infections is very important. I always tell people, if you have any, concerns, anything, you meet someone new. Actually, I have a good friend. She makes sure that, when she starts dating someone, she gets in a serious relationship, they both go and get tested for everything so they can both see those results and say, yep, I'm clean. I don't have anything, so that there is that open, honest communication and no risk of hurting someone. And of course, pleasure. Pleasure is the main thing. We always say that sex should never be painful and it needs to be pleasurable for both parties. So that's really something too, especially with our cancer patients. As you're navigating through treatment, your body's going to change. Things aren't going to feel as good as they did before. And that happens naturally too. As we get older, our bodies shift and adjust. What you enjoyed when you were 20, you're not going to, feel the same way when you're 40, when you're 60, when you're 80. However, that doesn't mean that you can't have a sexual relationship or still feel that pleasure. It's just going to look different. And there's a lot of fun in that too. There's an exploration piece that you get to go through, and with yourself, with your partner, however that works, just so that you are still enjoying it throughout. So some of the common side effects we see, especially with our cancer patients, whether you've gone through chemotherapy, radiation, surgery, hormone treatment, you're going to be experiencing sexual health side effects. The body changes due to treatment, fatigue being a very common side effect. When we're tired, the last thing we really think about is wanting to be intimate, or we don't even really feel good in our own skin. And then you have your hair loss, weight gain or loss, skin changes, scarring, that all impacts your sexual identity. And definitely too, surgery. If there's, parts of you that were there that are no longer, they've been removed or you've had reconstruction, but it's different. It's not your natural body. Even when you do like the fat grafting or the deep tissue for our breast patients, I've still had some of them say it just feels different. I know that's still a part of me and I'm glad that I didn't have an implant put in, but it's still a lot to adjust to. And it's important to give yourself that grace and that time to get to know your body again. And certainly too, a lot of our gentlemen, go through treatment, especially for the prostate cancer. That's going to impact your functioning. A lot of the gentlemen have erectile dysfunction, or they find that there's a little bit more of a flaccidness to the penis. And, that's an important thing to recognize too, and say, okay, now my body's changing. How can I still be present with myself in order to be present with my partner? Painful sex, the dyspareunia, is definitely something that a lot of our female gynecological, even breast patients experience just because of that vaginal dryness. So those are all things that, our sexual health team are here. We specialize in that oncology piece because we know so many changes happen. And definitely too, the desire, libido, the sex drive, that will change, especially if you're actively going through treatment, you're in survivor mode. So, if you're trying to survive, the last thing you're thinking about is, having all that blood rushing to your genitals to, feel that pleasure. It's, okay, how do I get from point A to point B to get through this treatment and keep going on with my life? So, those are all things that, really impact, our relationship with ourselves, with each other, and just the identity that we have as a sexual being. And, sometimes too, I know there's some people that, that sexual piece isn't important. However, for, pelvic exams for our women, I'll tell them, even if you're not sexually active, if you've had radiation in the pelvis, you might need dilator training, or you need hydration just so that those pelvic exams aren't excruciatingly painful, so that you can get through the healthcare piece as well. So I'm going to look at some of the stigma around talking about sexual health. So interestingly, 50 to 90% of adult cancer patients experience some changes in sexual function and satisfaction. 50 to 90%. That is a huge amount. So when we look at, stem cell transplant, it's 50% of men and 80% of women. A lot of the women will get vaginal graft versus host disease. So that too causes, some of the painful intercourse, some of the dryness. So that's, a huge amount of people. Prostate cancer, 91%, breast cancer, 70%, colon cancer, 85%. Cervical 30 to 79, depending on treatment. Ovarian cancer is about 50%, lung cancer is 95%, and thyroid cancer is 40%. So those percentages might really shock and surprise you. I mean, some of them, even for myself, I was like, lung cancer is 95%. Wow. I would have thought that, the ovarian cancer would have been higher than the lung cancer. And, looking at that though, too, and seeing all those percentages, that's a lot of people that are impacted by sexual health, and also a lot of people that don't say anything or it isn't discussed with them. And I always, say, if you look at all those percentages and that was the percentage of people that were having pain or fatigue, that's something that instantly, those are a lot of common things that our patients will talk with us about. And it's like, all right, here's a solution for it. But it's sexual health. So it's not treated the same way. And for some of that, there's that stigma about sex, sexuality, and sexual health as being taboo topics. We don't talk about that. That's something that's, discussed in the bedroom. It doesn't leave the bedroom. And I mentioned before, sexual health is often misconstrued as the act of sex, which is, like I said, private and personal rather than that overall well-being of a person, their quality of life. So most patients with sexual health concerns, it goes unaddressed because the providers don't ask the questions and the patients are too embarrassed to bring them up. And if our providers aren't saying it and the patients aren't saying anything, then our patients are still suffering. So this is really, to help kind of shed some light on the fact that if you're experiencing sexual health concerns, you're not alone, definitely not. And a lot of patients report that if their provider doesn't ask, they don't say anything, and that's because it doesn't feel like a safe space for them. And those topics, if they are discussed, a lot of times are just very brief and the subjects change quickly. Or I know I've had a lot of gentlemen where they'll say, well, I talked about just having some issues with erectile dysfunction, and they wrote me a prescription for Viagra or Cialis, and I tried it once, it didn't really work. So, I just figured this is how it is. I've actually had a lot of female patients that have talked with their gynecologist, and they say, well, that's just something that happens with menopause. So, you're in menopause, you just deal with it. And there are some things that unfortunately we don't have a solution for. However, there's more things that we do have solutions for, ways to provide a little bit more quality of life and help you embrace things more. So there's actually more things we can do to help than the things that are discouraging. So, definitely too, if you're feeling embarrassed or frustrated or believe there's no solutions to your concerns, uh, come to us. I mean, that's what we're here for. We're definitely happy to troubleshoot and see, that you might be surprised, especially for, gentlemen, you can have an orgasm without an erection. And, our brain is our largest sex organ. So it is really looking at, okay, what else can we do? How can we increase that desire or help you, or even just start those conversations? So looking at that, what are some things that you can do as our patients? So have that tough conversation. So all of your providers are here to help, even if it is uncomfortable or an embarrassing topic. So really think about your own health. If you were in extreme pain, you would tell your physician, no question about it. And your sexual health is important too. So it's looking at it as, something that, you want a solution for. So if you're unsure how to start the conversation, you can simply say something like, I've been having some sexual health concerns. Who can I speak to about them? Or even just writing them down and your provider can read them if it's difficult for you to speak about them. Certainly too, we recognize that there's different, religious, beliefs around sexuality, or, sometimes too, it's more like, one of the spouse, they want the spouse to talk about it, or they don't want the spouse in the room, or things like that. So, whatever helps you to be more comfortable, we're happy to oblige and make that happen. If your provider can't help or seems to brush you off, just ask for a referral to a sexual health provider. And certainly too, at City of Hope, we have our team here. There's also, we can always refer or online. ASACT is the American Sexuality Counselors, Educators, Therapists Association. So you can even look up online and find a provider outside if you prefer that too. So when you schedule with a sexual health provider, you would meet with a certified sexual health counselor, therapist, or educator, and they will give you psychoeducation. So help you understand your body and the changes that it's going through. They'll look at intimacy. What does that look like for you? Because we know that that's different for everybody. Sometimes, intimacy is just simply, I want my partner to hold my hand again because they're afraid to touch me. Or it's, I've gone through all this treatment. I've had all this different reconstruction. Things are different. It looks different. It feels different. What can I do to bring that pleasure back or understand? Body image is huge for men and women, just because you look in the mirror every day, and especially after going through treatment, that person looking back at you might look like a stranger. So it's saying, how do I get to know that person again? This new version of me, so that I can move forward and build relationships with myself and with my partner. Communication. So communication, of course, with your providers, but also with your loved ones, those people that you do want to be a little bit more intimate with, your spouse, your partner, whoever it might be, just being able to have those open dialogues. And of course, overcoming the trauma of treatments. We know that going through any kind of treatments is traumatic to your system. It hits you emotionally, physically, mentally, just spiritually. The whole body gets impacted by that because things are shifting and changing. Your perspective's changing. You're asking a lot of questions. You're gaining more insights into yourself. All of those things. Of course, I mentioned Viagra and Cialis. How to use that in conjunction with penile rehab for our gentlemen. Sometimes it's not as easy as taking a pill, but there's more things that need to be done with that, whether it's pelvic floor rehab, different penis pumps, things like that. So definitely talking with a specialist can help you to gain some more control over those things that you feel you don't have control over. Menopause change some symptoms, especially for our patients that start the hormone treatment. You don't go through the menopause stages like we typically would naturally, where you have the perimenopause, where you start getting those signs of, okay, it looks like I'm gaining a little bit of weight, or, I'm starting to notice some changes in my body. It's, you take your hormone treatment and just like that, you're in menopause, and we don't know how your body's going to respond because you didn't have some of those gradual warning signs. So, you could have the hot flashes, the mood swings, the vaginal dryness is very common with that. So it's looking at, okay, how do I manage all of these things when my body just changed and it's going through this circuit of what just happened? And, internally it's starting to kind of freak out. And, externally you're sitting there saying, okay, I don't even know what's happening or inside me anymore. Being sexually active safely while going through cancer treatment. So making sure that you have all those precautions in place so that you're keeping yourself safe and you're also protecting your partner from any exposure. And of course, fertility preservation. So you know that with a lot of our treatments that will impact preservation. And women 46 and younger are eligible to do egg harvesting, and gentlemen age 55 and younger are able to do sperm banking. So those are definitely things to think about, especially in this day and age. There's a lot of people that are waiting longer or later in life to have kids. So it's saying, okay, well, now I'm at that cusp of, we were talking about having a family and I just found out I have a cancer diagnosis. So there's a lot that goes into that too. I've had some patients say, I don't know now that I have cancer if I want to go through with this. And others that say, I need to do this preservation just in case, because I don't know if my body will come back before functioning, or, if we decide we want to have kids and I don't do that preservation, then we have to choose different methods. But we also have a lot of younger patients coming in. I say a lot of people, in their 20s. So they're just, starting their life out trying to figure out what kind of career they have. And they're not really thinking about, all right, am I going to have kids or not? So there's a lot of, tough conversations we have around preservation just to make sure that everything is in place prior to starting treatment so that there are no regrets afterwards. So who can meet with a sexual wellness specialist? Pretty much everybody. Patients can meet individually, patients and their spouses or partners, patients that are not sexually active, patients that want to prepare to be sexually active in the future. So anyone who wants to be proactive in their sexual wellness. And, the important thing too is to ask yourself, how sexually satisfied are you? And again, this is going to be an answer that's different for everybody. And then how do we honor both people in the relationship? So certainly if you are, married or you have a partner, and you're going through the treatment and you might say, what, this really isn't important to me, and the partner's saying, well, it's important to me, or vice versa. I've had actually quite a few patients that say, this piece is still really important to me and my spouse is just disinterested. So definitely trying to make sure that we look at that communication piece too. Like, where is that disinterest? Is it because they have their own things going on? Is it because they're focused more on being a caregiver? So we really tease apart to that patient caregiver role to make sure that we still have that spousal role, your couple in there, because that is an important piece too. And even being able to have those conversations. We often find that we put a lot of assumptions onto our partners and we don't talk about it. So I've had, quite a few patients that said, well, I look ugly now, because that's the view that they have. And they say, like, I know that my husband doesn't find me attractive. And the husband sitting there saying, I'm just afraid I'm going to hurt her. So I don't even want to touch her. I'm like afraid to hug her. So let alone, I'm like, I'm not going to have sex with her because that's going to be a lot more to the body. And, when we have those conversations, we're able to start that dialogue, we actually can find that, both partners are trying to find a way back to each other. They just don't know how to bridge that gap. So it's really fun too to explore that and say, okay, well, what can we do to help, light that fire again or make you comfortable with each other? And that's certainly something, that we offer here at City of Hope, just to make sure that that quality of life piece is addressed. And, as you're moving through, and if you find that, your doctors or your nurses don't completely seem comfortable with that topic, just say, hey, I know that there's someone that works here. Is there a way that you can just get me in touch with them to talk about the sexual health piece, or that me and my partner can, meet with them? We're happy to do that. And we do phone calls, we do telehealth. We definitely meet in person. I think a lot of people prefer in person, but if it's a couple, we will do like the telehealth. We want to be able to see both of you, and then certainly too, if you have any phone calls that you want to make, just to discuss concerns or things, we're happy to do that as well. I definitely want to make sure that everything is addressed in a way that makes you feel comfortable and confident again. And just some resources. I know I mentioned the ASAC before. So this is really the national database. You can find someone pretty much in every state. Not all of them specialize in oncology sexual health. However, they have enough of a knowledge and a background to be able to assist you or get you the resources that you need. The Sexual Medicine Society of North America is also really a great resource for just more information, things to help you as you're researching things. I definitely want to make sure that you have some great solid resources. And then here's some books and podcasts too. So a Better Normal by Tess DeVez. She is actually a breast cancer survivor. So it's definitely a wonderful resource as well from her own personal experience. And then we have some podcasts. Sexology is one that covers a wide range of topics. Sex with Emily is really good for people in their 20s, 30s, and 40s. Some different products. Mystery Vibe is a great resource for men and women. There's a blog and resources, different toys. So as you're kind of exploring things again, that's a great place to go. And of course, Women Cancer Sex and Men Cancer Sex. Ann Katz is a a nurse that has worked with cancer patients for many years and wrote these books to really talk about those different, side effects and symptoms that we experience. And these are great things to read with your partner. Make it a date night so that you can, listen to the podcast episodes or read some of the books. Elephants and Tea, that's a resource for adults with cancer, and convectostomy resources. So definitely, if you have an ostomy, that's a great place to go to, because when you have a bag connected to the side of you, that also will impact the way that you feel about being sexual or even active in general. So these are all things, like I said, look at them by yourself with your partner so that you can start those conversations and have a better understanding of what each other is going through. I think that's the biggest place too, is we often, as I mentioned, we kind of project those thoughts or kind of guess what the other person's experiencing. And if we can do less of that and more of that conversation, that will help grow your relationship as well. So thank you very much. I hope that this has inspired you to reach out to your providers. Certainly, you can always contact me through Cancer Fighters, myself and the rest of our sexual wellness team, of our pelvic floor rehab providers as well. We are all here to help make this journey a little bit easier, especially when you're done with treatment and reintegrating back into your life. We want to make sure that you have everything you need to do that. Thank you.